Welcome to Lifestyle Med with Dr. Jade. Health, it's a lifestyle. Hey family, and welcome back to Lifestyle Med with Dr. Jade. Thank you so much for your support of this channel and coming back. If you're new here, welcome. I'm Dr. Jade. I'm a family medicine physician resident, and on this channel, we talk all about fitness, nutrition, and primary care hot topics. So if those are topics that are of interest to you, please hit the bell and the subscribe, the like button, and make sure to continue to tune in. And today on Lifestyle Med with Dr. Jade, we are talking about depression. Are you depressed? Do you have symptoms of depression, or is something else going on? With all that's going on in our world, 2020 has been a crazy year for all of us here in America and the world. And so depression is on the rise. Lots of patients are going to see physicians now with different medical complaints, and really they are depressed. So if you're wondering if you're depressed, or if you're having symptoms of depression, or something else is going on with your health, in this video we are going to be covering the top 8 symptoms of depression. And according to the American Academy of Family Physicians, 8% of Americans are impacted by depression, and 210 billion of our healthcare dollars are spent on depression every year. Your primary care physician should be screening for depression in all patients 12 years and older. And when you see your physician, they will typically give you a patient health questionnaire with 2 or 9 questions on it that screens you for depression. And we're going to be talking about those symptoms here today. So I am a huge fan of mnemonics. It helps me to learn and to retain information. And so today's mnemonic for the symptoms of depression that we're going to be covering is called SIG-E-CAPS. And this is the common mnemonic used by physicians to screen for depression. So symptom number 1 for depression is sleep. And this can be an increased or decreased amount of sleep. Some people will find that when they are feeling depressed, they will sleep a lot more from their baseline amount of sleep, while others will find that they have insomnia and have very little or poor sleep quality. So if you are noticing that you are having sleep problems or differences in your amount of sleep, either more or less than you typically would get, this is a sign that you may have depression. Symptom number 2 in depression is interest, and this is a decreased level of interest in things that you would typically enjoy doing. This term in medical terms is called anhedonia. So if you are noticing that, say you typically like to, go to the movies, or you typically like to work out, but lately you just haven't been wanting to do those things that you normally love doing, that is also a symptom of depression. And symptom number 3 is guilt. And this can be in the form of feeling more regretful or hopeless or worthless. If you are feeling more guilty, hopeless, worthless, feeling like life just isn't worth living, these are all what we put in the category of guilt and may be a symptom of depression. Symptom number 4 is energy, and this typically is a decreased level of energy, often in the form of just feeling more fatigued. So if you notice that, say your sleep quality isn't affected, or it is, but you just notice that for whatever reason you are just more fatigued, more tired lately than you normally are, this could also be a sign that you are suffering from depression. Symptom number 5 is concentration, and this could be in the form of being more forgetful, having issues with your memory lately, or just feeling like you can't concentrate on tasks that you're usually able to focus on. So if you've noticed that your focus or your concentration is more poor lately, then this may be another sign of depression. Symptom number 6 is appetite. So this could be in the form of an increased or a decreased appetite. Some people will notice when they're feeling more depressed that they eat a lot, they binge eat, they may call themselves emotional eaters, while other people may notice that they have no appetite or just don't want to eat or eat much less. So changes in your baseline or your normal appetite level, either increase, eating lots of food compared to what you would normally eat, or just not having an appetite, that may also be a form or a sign that you may be depressed. Symptom number 7 is called psychomotor changes, which is basically your movement. So typically we move at what is our normal pace. But if a person has psychomotor depression, then this may look like very slowed movement or moving more slowly. And this can also be in the form of what we call psychomotor agitation, where you are just more fidgety and more agitated in your movement. So if you notice that even your body, when our mind is off, it really is impacted in our body and our movement. So if you notice that you are just like dragging along and moving more slowly, it's taking you a lot more time to get things done. Or if you just notice that you just can't sit still and you're agitated, these are both forms of psychomotor changes that is proliferating in the body that could be signs of depression. And symptom number 8 is suicidal thoughts. And this could be in the form of just having thoughts of wanting to harm yourself, thoughts of wanting to end your life, feeling like, again, like life isn't worth living. This is very, very serious. We definitely screen for this in our offices to make sure that our patients are not in a place where they feel like life is no longer worth living. And so if you are feeling like this, please, please reach out to your doctor, reach out for help so that we can get you the help that you need. So now we've covered the 8 symptoms of depression, but say that you have one of these symptoms and say, yeah, my sleep's been a little bit off, but I don't really have the rest of those things. Or say, well, I answered yes to a couple of those, but I still don't really think I have depression. So what tells a physician if you have screened positive for depression versus screening negative? And so that is if you have answered yes to 5 or more of these symptoms, and you have had 5 or more of these symptoms for 2 weeks or more, that is a positive screen. I'll say that one more time. If you have answered yes to 5 or more of these symptoms, and you have had 5 or more of those symptoms for over 2 weeks, that is a positive screen for depression. So what do we do about it? And depression can be treated in a couple of different ways. That can be in the form of therapy, in the form of medication, or a combination of those things. If you think that you may be depressed, or you have screened positive or answered yes to 5 or more of these questions and have had these symptoms for more than 2 weeks, please see your primary care physician so that we can get you the appropriate treatment plan that is right for you and your health. Thank you so much for tuning in today, guys. If you enjoyed the content in this video, or if this was useful information, please hit the like button. That helps to let the YouTube algorithm know that this is content of interest. We will continue building this channel and growing this channel together. Thank you for being here. Like, comment, share, and subscribe. You guys, I will be back next week with a hot topic in healthcare or nutrition or fitness topic. And let me know below, what are some topics that you want to hear about? I'm here to make content that you are interested in. So thank you so much for being here, and I look forward to seeing you next week. Bye. If you enjoyed the music on this channel, make sure to check out the description box for your own custom music by C Major Nation. And as always, be sure to like, comment, share, and subscribe. Thank you, and God bless.